You've talked about it and you feel ready to have sex, but do you know how you're going to protect yourself against sexually transmitted infections or unplanned pregnancy? Condoms are the only contraceptive that protects against both STIs and pregnancies. Condoms are 98% effective and only usually fail if they have not been used properly. Let's find out how to use condoms correctly. First, you need to know what size condom fits you best. Too small and they can feel uncomfortable and tight, and at worst split. If they're too big, they can come off during sex and increase the risk of transmission of an STI or an unplanned pregnancy. Penises come in different sizes, and condoms do too. Once you know what size suits you, check a few things to ensure that the condom is safe to use. Check the condom has either the British kite mark or the European CE safety mark. The kite mark doesn't cover latex-free condoms, but they will still have the CE mark. You also need to check that the condom is still in date. Check the packet is not damaged or pierced. Squeeze the packet and you'll be able to tell if there's still air in it, a bit like a crisp packet. To open up the condom, feel for the jagged edge of the packet. Push the condom to one side, tear the packet open, ensuring the condom isn't caught and torn. Be careful of nails and jewellery and don't use teeth or scissors. Before placing the condom on the penis, make sure to check that the condom is the right way round. If you're unsure, you can pinch the tip and check if you can roll the condom down. Putting the condom on. The penis needs to be fully erect. Pinch the teat at the top of the condom to push any air out. There should be no air in the teat to give space for semen. If there's no room for the semen, the condom can split, especially as ejaculation can reach speeds close to 25 miles an hour. Whilst pinching the teat, place the condom on the tip of the penis. Continue to pinch the teat whilst you unroll the condom over the head and all the way down the length of the penis. If it doesn't unroll, it's probably the wrong way around, so throw it away and start again with a new condom. Don't turn it over and use it, as it can contain pre-cum. When a penis gets erect, it releases semen to act as a natural lubricant. Pre-cum can contain millions of sperm and potentially an STI, and this will then be on the outside of your condom. If you plan on using a water-based or silicone-based lubricant, now is the time to put it on the condom. Don't use body lotions, moisturisers, lipstick or Vaseline, as they are oil-based and can cause condoms to break. We will come back to this shortly. During use, always hold the base when changing positions. How to dispose of a used condom. After ejaculation, hold the condom on at the base until the penis is withdrawn, and then take the condom off. Check to see if the condom has split. A good way to do this is to run your fingers down the length of the condom to see if there are any tears. If this has split, tell your sexual partner and get a sexual health checkup, and if needed, discuss emergency contraception. After taking off your condom, tie a knot in it to prevent semen coming out. Wrap it in a tissue and put it in the bin. Never put it down the toilet. It will either float or block the toilet. Oil versus condoms. Earlier, we talked about the importance of using water-based or silicone-based lubricant. Don't use body lotions, moisturisers, lipstick or Vaseline, as they are all oil-based and can cause the condom to break. If you've been eating food that contains oils, then you should wash your hands, as oil can affect a condom like this. Water-based lube is available as part of the EC card scheme. You may choose to use lubrication for less friction and added pleasure. Top tips for using condoms. Don't use a condom that's been in a pocket for a long time or has been through the washing machine. Heat and water can cause damage. Store them somewhere cool and dry. Only use a condom once and then put it in the bin. They are not reusable. Put on a condom before any kind of sexual activity. This includes oral sex, as you can also get STIs within your throat. Do not ever use 2 condoms at the same time, as friction can cause them to weaken and split. Condoms don't need to get in the way or disrupt sex if you know how to use them. The best way to feel confident in using them is to practice. You can get 10 free condoms up to once a week in Suffolk. If you are aged 16 to 24, download the EC Card app to get access from a variety of pickup points around Suffolk. You can also go to the Suffolk Sexual Health Service website to access a variety of services including postal STI test kits.